Hello everybody, welcome back to Gotta Get Running. I'm Phil Hargis. It's good to see you guys again. We are here now. You know, peak performance has been achieved. We've run our fall marathons and all of our other fall training is like kind of done now. We're just kind of getting ready for the winter months. The winter months bring their own new sets of challenges, new cold weather. And you know, since our bodies have just gone through peak performance a little bit, they've been through the rigmaroles of all the tough training and everything. So your body is much more susceptible to training injuries right now. So we want to here, Gotta Get Running, want to bring you guys some information on how to do some good stretches and do some good training tips so that you can keep yourself injury free during this cold off season. So let's start off by introducing Chris Farley back to the show. Chris, good to see you again.
Good to see you. Happy holidays, man.
Yeah.
It's a great time of year to be a runner, and I'm healthy and running well and injury-free. I wish I could say the same for you.
Yeah, thanks a lot, man. I've had my struggles. That Big Hill courthouse will do anybody in.
That's right.
It was tough. Well, congratulations on a good Philadelphia marathon as well.
Thank you. Well, thank you. Well, good. Well, hopefully we'll get into that, and we'll also get into your injury, and hopefully we can. Our guest today can kind of help us work through your injury problems, along with a lot of other people's injury problems out there.
That's right. You got to get me back to running, but
yeah.
We have a special guest here in the house. This is everybody. This is Dr. Kathy Catino.
Yes, sir.
Of Positively Chiropractic there in Annandale, Virginia. Welcome to the show, Kathy.
Thank you very much, Phil.
Now go ahead.
Kathy, you are an amateur Xterra triathlete. Now, I'm a runner, so I don't know as much about the triathlon scene, but I hear you've competed 6 times at Worlds and actually won Worlds. So talk a little bit about that as we get it started here.
I am an ambassador for Xterra, so this is an opportunity for me to tell all our runners out there that one great way to prevent injuries is to cross-train. And Xterra is an off-road triathlon, so it's a 1,500-meter swim, it's a 20-mile mountain bike, and then it's a 10K trail run, generally speaking. Some are a little shorter, some are a little longer, but that's generally it. And so, yeah, I went to Maui this last October, and I won my age group and had an awesome race. So.
Well, that's great. Well, Dr. Kathy and I, Phil, have been working together for years at Pacers, and you know, we send a lot of our customers over to her, and she actually was part of our training program way back when. So we have a good long-term relationship, and she's been great at helping our runners, you know, get healthy. And so I guess we wanted to start off talking about some of the common injuries that runners might see. So maybe you can talk a little bit about that, Kathy.
Yep. So the best way to treat an injury is to prevent it in the first place. So some of the things that we've done together is showing people the stretches you can do to start right now, and hopefully this can help you avoid some injuries that happen to runners when you don't take care of your body after you've done your run. So I just picked the 4 most common injuries that come to our office with runners and the triathletes from the running injuries is Achilles tendonitis, iliotibial band friction syndrome, which can happen at the knee or the hip. So I called it 2 different injuries because people sometimes don't realize it's one tendon. And the last thing is a groin pull, and it usually is from the muscle called the psoas, which originates in your lower back. It inserts in your leg and shortens when you sit. So when you get up and run, you can very likely injure it. And so some stretching can help open that up and prevent running injuries.
Well, great. Well, let's get into it here, and let's take a look at Dr. Kathy treating Dr. Rose for an Achilles tendon injury.
Achilles tendon is at the very bottom of 2 major muscle groups: the gastrocnemius, which is at the very top of the calf, and the soleus, which is more at the very bottom. And both these muscle groups attach to the heel through this very thick connective tissue, the Achilles tendon. It's a very common tendon, unfortunately, that runners will tear, micro tear, or maybe a little bit more aggressively, but the treatment is the same with active release therapy. What you're doing is you're shortening the soft tissue, and you're getting right on the soft tissue with your thumb contact as an ART provider, and then you're basically lengthening the connective tissue while the thumb contact stays right below the scar tissue or the tear. And the idea is that the healthy soft tissue will slide underneath the thumb contact, but the scar tissue will just dissipate, will just break down. So you want to get on this as soon as you can if you ever hurt yourself, and that's a normal pass of what I would do to somebody who has some sort of Achilles issue. And when treating the Achilles, you always want to look into the plantar fascia, because these 2 groups do have common insertion points on the calcaneus, on this heel bone. And so I would also recommend you get your entire foot worked on with some deep manual therapy like ART. and then maybe a little bit up into the calf. The calf is also an extensor of the knee because it originates above the femur, above the knee joint. So you would also benefit by getting the whole calf stretched out like this. All right. And finally, most importantly, when you have some sort of soft tissue injury, make sure you get the joint treated above and below where the soft tissue has been torn to make sure all your joints stay nice and healthy and flexible so that they don't start creating scar tissue amongst themselves too.
And one of the things I've been struggling with for the last year or so is IT band injuries, and here is Dr. Kathy working on an IT band.
Okay, so next thing we're going to treat is the insertion point of the iliotibial band, which is at the very bottom of the knee. And so I'm going to have Dr. Rose flip over onto her back. And we're going to work on Dr. Rose's right knee on the very bottom. So the IT band originates here at the hip, as we talked about, and inserts below the knee, right down here. And so to treat this tissue, you want to start with the knee bent, and you're going to feel, your doctor is going to get right below where your pain is, and the pain is usually right here on the side, where the tight band of the iliotibial band comes and crosses over the femoral condyle, which is a bony prominence, and instead of gliding over it at 10 degrees of knee flexion, it starts to rub in friction, and that creates a real sharp pain on the side of the knee. And if you've ever experienced this, you know exactly what I'm talking about. So as a provider, what we're going to do, we'll get right below that area of scar tissue, and then you lengthen it like this. And Dr. Rose is a runner and has some good tightness right here as well. So she's going to get a little therapy out of this. And it feels like it doesn't feel like a foo-foo massage. Active release therapy is getting into scar tissue, and it's designed to break down your adhesions where you have created some wear and tear from the repetitive motion of running. And so it just comes with sometimes with just poor form or bad shoe wear, the terrain that you're running on. But the knee and the hip you got to be very careful with, and there's lots of ways to prevent that, and we'll talk about that again later.
All right, and the next injury we're going to take a look at is Dr. Kathy treating Dr. Rose for an origin and insertion of the IT band. Did I say that right?
You did.
All right, let's go to that one.
So now we're going to go to the top of the IT band, but I'm going to have Dr. Rose roll on her right-hand side. We're going to work on the left origin of the iliotibial band, and its origin's right up here. And so sometimes as a runner, you'll be running along, and you'll feel sharp pain right in the side of the hip. And what that is the IT band, which is still tendinous here and muscular here, stops passing freely over the side of the femur, but it starts to friction rub here, and there's a little bursa underneath, and that can flare up into a bursitis. And it's a sharp pain here. It's not as bad as the knee, but it hurts a lot. So how we treat that is I would have Dr. Rose now bring your left knee up to your chest, and then let your left foot fall to the floor. And my thumb contact staying very steady right above where this is very common injury occurs. And come on back, Dr. Rose. And so that's a way to start loosening up this scar tissue where it can start to adhere from the femur to the pelvis. And so that's no good. And I would also treat this with getting the pelvis adjusted as well as the lower back to make sure that your whole balance is intact as the soft tissue is healing. Okay, so that's the iliotibial band.
Okay, another injury that I've struggled with over the years is a psoas injury. So Dr. Kathy will be demonstrating on Dr. Rose how to treat a psoas using active release therapy.
Next thing we're going to go to is the psoas, which is your primary flexor of the pelvis. And what do you do when you sit? You shorten your hip flexor. And what do you do when you're running, cycling, hiking? You're contracting and shortening the hip flexor. So it's a very, very important muscle to keep flexible, and it's also the only muscle in the whole body that not only originates on bone, but also on the spongy disc between the vertebrae of the lumbar spine. So people may feel real sharp, deep groin pain, or like a deep, non-specific pelvis pain. That can be hip psoas pull, a strain. So Dr. Rose can bring her left knee up, and what I'm going to do is I'm going to get right into the groin, right here, right into the belly, and I'm going to have Dr. Rose bring her left leg back towards me and straighten her knee and bring her left arm over your head and take a deep breath in. And that's the fun psoas move. ART. And come on back, Dr. Rose. Another way I can get a little deeper is if I bring my hand a little bit more towards the belly button. I can get, like, the psoas is very thick and very powerful, and when you tear it, it's very profound. So there's different spots where you can actually tear it. This is another spot I can feel a lot of tightness in poor Dr. Rose's overused psoas. Come on back with your left leg. Dr. Rose is an excellent runner, and she has all the running injuries that we are treating here has had over the past couple months. How's that feel?
Oh, it hurts.
Yeah, feels so good.
It feels so good.
All right, so that's the psoas, one way of treating the psoas for hip pulls. And I would also suggest that you get your pelvis adjusted to make sure that your whole lower back stays flexible and in balance as you're healing from the soft tissue injury. Okay?
Okay, so now that we've learned how to treat these injuries that you get, now, there's certain stretches that you can do to prevent these.
Yes.
And preventative stretching, I'd like to touch on that, but also any other preventative measures you feel would be necessary to keep our guys healthy would be great for you to touch on as well.
Okay, so I recommend that all runners should spend, within 20 minutes of finishing your run, spend at least 5 to 10 minutes stretching your body on the muscle specific to the running, and if you're biking, specific to your sport. So, well, how you stretch is as important that you stretch. So I have my patients spend 30 seconds per stretch, as I mentioned in the stretch part of this video. And so you should spend 30 seconds and breathe and relax through your stretch and don't bounce because it's.
So I'm not touching my toes and bouncing up and down. That's not,
That's
no, I'm
old
not doing that.
school,
Yeah.
And
Right.
it's actually counterproductive.
Right,
And so,
right.
yeah, we have our patients just breathe through the stretch and just relax and hold it for 30 and then repeat that 2 times.
Okay.
So, and you should do this after you're running within 20 minutes of stopping. So try to do it right away is my point. And that prepares you for your next run injury-free. If you don't stretch, you're going to go into your next workout tight, and that can make you more vulnerable to tearing.
Great. And I did also want to touch on, so obviously stretching important, but some of the tools that our runners are going to use,
Yes.
Particularly the shoes are obviously important too.
Yes. So prevention, as I said, is so awesome. If you can follow some simple rules, whether you're a walker or a beginner runner or an advanced athlete runner, you should change your shoes between 300 to 500 miles, right?
Correct. That's right.
And
That's right.
you are reinforcing this with all my patients that come to your store, and I love it. So it's like awesome. So 300 to 500 miles, if you change your shoes, it really helps prevent any breakdown in the shoe that can lead to overpronation syndrome, that can lead to IT band or Achilles problems or overcompensation in the hip. So changing shoes. Orthotics are really good for certain individuals, and custom orthotics are very specific for people who have any type of imbalance in their way their gait moves through the running cycle. And so whether you're walking or running, if you have a dropped hip or a fallen arch, sometimes a custom orthotic can really help prevent an injury from happening before it can snap.
And they have some over there at their practice there in Annandale. They have some really cool state-of-the-art scanners. Well, you can go step on there and they'll scan your feet. And then she's an expert at reading these images that come off of there.
And she can make orthotics. She can do a gait analysis. All types of sort of fun stuff there. So let's get back into the stretching. Okay. So we're going to do a calf stretch for the Achilles.